Migrant workers who need emotional support can call a new 24-hour crisis hotline created just for them by two non-profit groups.
One of those groups is HealthServe, and joining us live is Justin Paul. He's head of Mental Health and Counselling Services there. Good evening, Mr. Paul. What are the key mental stresses that migrant workers here in Singapore face?
Good evening. The migrant workers are facing quite a number of different distresses, partially recovering from the long period of lockdown that they had during the COVID period. We do know that they are still restricted in their options to go out. Aside from that, many of them are also dealing with different situations, both in terms of their health as well as their mental well-being in being able to manage the different distresses. Particularly for those who may have issues that are happening within their home country as well.
And how far do current measures help with tackling those issues?
We do have some services already that are available that works together with dormitory operators, stakeholders, employers, and even the Ministry of Manpower that allows for them to refer cases to our hotline for counselling support. And we also do group support when necessary. However, we have also noted that these are only available during the office hours, and we are hoping to be able to upskill our services to provide this 24/7 service as well.
So, Mr. Paul, can you give us some detail as to how this new hotline, it's 24 hours, how is it going to help address some of the challenges that you've described?
So one of the things that we learned during COVID was that we realized that many of the migrant workers faced the difficulty of being able to communicate the challenges that they had, partially due to language, which was the reason why we decided to set up a virtual clinic last year to try and address that, which was held 3 times a week. And some of the feedback that we got from that was that many of the workers, even just by having a conversation with someone who speaks their mother tongue, found relief and a bit less anxiety after the conversation. Therefore, we realized that there is an importance in allowing them to have someone that they can speak to in their native language, and also the opportunity for them to be heard whenever they face difficulties or distress. So through this hotline, we hope to be able to have this service manned by native speaking volunteers and staff who can listen and be that listening ear for the workers, and if possible, even de-escalate any anxiety or severe cases where they may be unsure about what to do, or they may be on the brink of doing something that may not be very healthy for them.
And do you think the migrant workers will embrace calling in?
We believe that it may be a slow start, but what we've learned was that when some migrant workers have had a good experience through the line, they will start to spread the news, and that would be something that would be a good form of information to let them know that the line that they're calling is a genuine line that is there to help them. We also do not expect this line to be available for migrant workers, but we also expect that employers, dormitory operators, and even friends of other migrant workers may actually be using this line to connect us with the migrant workers so that they can get the necessary help.
And to the point of the role that employers perhaps can play, Mr. Paul, what are some of the signs that they might be able to look out for when it comes to the health of their workers?
One of the things that we do note is that for the employers, particularly team leaders, supervisors, the ground staff who are managing the workers, they would be the ones that will see the workers day in, day out. And this is an important sign because whenever someone is going through mental distress, usually they get affected in 4 different areas. They get affected in their rest, in their regular meals, in their energy level, as well as their motivation to be able to do the tasks that are given to them. By being able to observe certain changes in one of these 4 areas, it is already an indication that something may be distressing to the worker, and it may be good to start a conversation with the worker. One other possible sign that could be useful for employers to take note is if they see the workers are having an increased rate or frequency of reporting sick. This could be something that could also indicate, because a lot of physical signs are psychosomatic symptoms of mental distress. Signs such as headaches, breathlessness, neck ache, shoulder aches, or even sometimes even stomach pains, These are all signs that do come up when a person is distressed, and sometimes they may ignore it, thinking that it's just a part and parcel or from their daily work. So if there are signs like this, it may be a good thing for the employer to just take note and maybe just to start a conversation with the worker to check whether there is something out that's maybe disturbing him.
Mr. Paul, thank you very much for talking to us about this important issue of migrant workers' mental well-being. That was Mr. Justin Paul, the head of Mental Health and Counselling Services at HealthServe.